Something happened at RSNA 24 that hasn't happened to me before. I had an in-depth cybersecurity discussion with a radiologist. They even suggested that radiologists sometimes need to take a leading role when dealing with a cybersecurity incident. Hello and welcome to Healthcare IT Today. I'm Colin Hung here in Chicago, Illinois at RSNA 24, and joining me on the program today is Dr. Raj Chopra. He is Chief Medical Officer at Merge Merative. I can't wait for you to hear what he has to say about cybersecurity and radiology. Let's get to it.
Dr. Chopra, welcome to the program.
Thank you for having me.
I'm excited to sit down with you because we're going to talk about a topic that, frankly, I don't think gets talked a lot about here at RSNA, or maybe not as much at RSNA, and that is cybersecurity. But before we dive in, can you just give our audience a little bit of your background and your role here at Merative?
Sure. My name is Raj Chopra. I'm the CMO at Merative Merge. I've been a radiologist for 20 years in private practice and been president of a semi-large group on the West Coast for a while, and been affiliated with Merge for about a year now.
And cybersecurity. We were talking before we got on camera about how a lot of it isn't caused by radiologists. I mean, you don't have that many devices that are targets for cyber criminals just yet. But as you were saying, radiologists sometimes become the face of a cybersecurity issue because you're talking with fellow clinicians, you're talking with patients.
Yeah.
Tell me more about that.
So in the world of cybersecurity, I think the physician or the radiologist is not the center point of what we think about on a day-to-day basis. What we think about is, are we able to read our images? Are we able to, is the PACS working? Is the power on? Is my tech doing a good job? But when cybersecurity occurs, or an event occurs, a cyber attack occurs, and everything goes down, we definitely become the center of all the attention because we're the focal point of the communication of what's happening, right? To the patient who's waiting for their scan to get done, to the clinician who's calling us to find out the results, to our own staff trying to get their work done. We're sitting in the middle of it with a lot of frustrated people. And oftentimes we don't know what to say when the event occurs. So I want to bring attention to the fact that vendors that are out there, if they do a better job of informing us, we can be better at informing everybody else.
Gotcha. And what are some of the things that have happened in your experience that are, that kind of brought you to this conclusion?
Yeah. So we recently had a major attack that affected a lot of folks out there, and you probably know what it is. But when that event occurred, we weren't able to read images. And we had a lot of frustrated physicians, especially because they're waiting on our results to move forward with, getting their office visits up and running, to get their surgeries done, figuring out what's next for the patient. And we really had no idea what was happening. The vendor kind of turtled up and didn't say, that's my words for it, where they just don't say anything to you because I think they're worried about what they can and can't say. And we're worried about what we can say. And instead of letting us know what was happening, they just became quiet. And when that happened, we were stuck. We're in the middle of something and we had no idea when it would get better. So that made me go, we need to do a better job in this space to communicate with the doctors who are the frontline agents of when something goes wrong. And we as a vendor community need to do more, and we just haven't yet.
You gave a fun example because, oftentimes healthcare gets compared to banking, to hospitality, to retail. And when we compare ourselves even to something like the airlines, we're in trouble.
Yeah.
But you went even one step further and you compared healthcare a little bit to a power company.
Yes.
Tell me more about that.
So on the West Coast, we have this power company that is well known. I won't mention their name, but we often have downtimes and power outages, and those power outages result in pain for all of us. But the one thing they do really, really well is communicate to you what's going wrong. So the power goes out, you're aware that the power went out, but you get a text message that you've registered for it. It says, hey, the power's out and we're going to be sending crews to go fix it. Then you get an update a few minutes later that says, hey, the power's out. We're at the site where we think the power went out and we're diagnosing it. Then you get a follow-up text message saying, hey, we're diagnosing it. We think it's going to be 2 hours. Then, about an hour and a half in, they go, it's going to be more than 2 hours. It's going to be 3 hours. But now we've figured out what it is. And then they'll tell you, okay, it's going to be fixed now. So even though you're going through that pain of that power outage, they do a very good job of letting you know and keeping you engaged that they're working on it. So that there's something that you can tell to whoever else is relying on that power. For me, it was my wife, right? I tell her, hey, it's going to be up in an hour. It's going to be up in 2 hours. It may not be accurate, but at least there was that line of communication. Whereas when my event happened in the cybersecurity space, as a healthcare provider, they just didn't say anything. So there was no information going out, and that lack of information ramped up the amount of frustration everybody was experiencing.
So other than communication, what can a radiologist do to improve this kind of situation? Is there anything that you could do from a technical point of view? Is it really just relying on and working more closely with your vendors?
I mean, working closely with the vendors is key. I think keeping your own, even internally as a physician and as a medical group, a system in place. When things go down, we're going to communicate this way, right? I don't think we think about those things because we think of it as a utility. We think of it as something that's supposed to work and we just expect it to work. So when something goes down, it's always like your hair is on fire, right? Instead of having a plan. And just like a vendor needs to have a plan, we as radiologists need to have a plan when something bad happens.
Right, like almost like a playbook. We were talking about football before, you gotta have a playbook for when this happens.
Exactly, step 1, 2, and 3.
So what kind of services does Merative help? Do you guys have something in this sort of space or?
We're working on it. What we're doing is listening to our clinicians more closely nowadays. We're trying to figure out what is the best way to communicate, what is it that they want to hear and what they want to know. And I think we are relying on our vendor community to say, what is out there? What should we be looking at in different spaces that we can emulate the people who've figured it out and go from there. So Merative is listening. We're actively going through the process of finding a pathway that everybody can say, yeah, that's the way to go forward. Yeah. And I think starting with highlighting it, which is something that nobody's doing right now.
Gotcha. What other kinds of services are you showcasing here at RSNA at Merative?
Oh, we have our Merge Universal Viewer. We have our VNA, our cloud. There's a lot of things in technology that Merge and Merative is working on constantly that is innovative and very exciting. We're really focusing on trying to make sure that the clinicians, which are being hammered by the amount of work that's coming in and the physician shortage, how to make them more efficient. So our purpose right now is about efficiencies, how to make things work in a timely fashion so that we can provide care at a real-time, quicker level.
Awesome. Well, Dr. Chopra, you've shared a lot of great information with us today. Where can people go to learn more about Merge and Merative? We have a website. You're more than welcome to hit us at merge.com and look at what we've got going on right there. You can reach out to myself or any of our team. We're super excited to talk with folks, and we're here for you. Well, Dr. Chopra, really appreciate your time on the program and appreciate all the information you shared.
Thanks for having me. I appreciate it.
A big thank you to Dr. Chopra for agreeing to come on camera with me to discuss cybersecurity. I loved how he highlighted the importance for radiology department heads and practice leaders to be a conduit for information when there is a cybersecurity incident and when the systems that they rely on are not available. In those situations, no clinician likes to be in the dark. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung here at RSNA 24 in Chicago, Illinois. Thanks for being here, and I'll catch you on the next video.